technically called SARS-CoV-2. It's the virus that causes coronavirus, discovered in 2019, or COVID-19. SARS was originally named for the severe acute respiratory distress syndrome that it caused in the first wave of SARS infections. I guess wave is our current COVID term, but the first type of SARS infection that caused us a major issue, and that was back in 2003. So that's where the SARS part of the name came from. The coronavirus, though, is most importantly a virus that spreads very easily from person to person, and to which most of us humans don't have any significant immunity. And this has been the issue with COVID-19, is that we became exposed to a virus that we're not really prepared to fight off. The other tricky thing about COVID is that the incubation period has been problematic. The incubation period, just to define it, is the time between the exposure to a virus and the onset of symptoms. And with COVID-19, the symptoms often show up 2 to 14 days after the exposure, if at all. Sometimes people don't even have symptoms. And the people are at their most contagious when they have COVID, when they're their most symptomatic. But people can be contagious before they develop any symptoms, in that window of the first couple of days, and can be contagious even if they don't develop any symptoms. So that has been one of the big challenges, that and our lack of immunity to COVID-19 has been, those have been the big challenges underlying our current situation, our current pandemic situation. I'm not a COVID-19 expert, but we're talking about this so that we can help bring COVID-related information to people with HHT. Because obviously there's lots in the media about COVID in general, and about COVID vaccines in general, but not much in the media about COVID and HHT. So Dr. Kasthuri and I want to share with you a little bit of our experience and the experience that we've gained from talking to other HHT center directors, and from talking to patients with HHT and COVID. We recently, Dr. Kasthuri and I and Dr. McWilliams from the UCLA HHT Center were part of a webinar run by Cure HHT, where we presented more extensively on the background of COVID and COVID vaccines and the information about COVID and HHT. But I thought I'd give you a couple of highlights about it, and then I'll refer you back to that webinar for more details, because that webinar is available online on the Cure HHT website. So leading up to the talk, which was just a few weeks ago, we surveyed the HHT centers of excellence across North America and got details back from 13 centers. We asked them to tell us about all of their patients that they were aware of that had had COVID. And so the numbers were quite small. We were able to hear back about 30 patients, and most of the patients had very mild disease, as is typical for most people with COVID. There was one COVID-related death amongst the HHT patients. There was a patient who also had a heart attack and one who had a stroke. These are very serious outcomes, clearly, and the COVID-related death was felt to be really related to severity of the infection. But the other complications were related to underlying comorbidities, or at least very connected to underlying disease in elderly patients. Interestingly, though, there's been a lot of talk about and concern about blood clots complicating COVID infection in general. And the HHT community has been concerned about whether or not that's how that influences the outcomes for people with HHT who get COVID. Of the 30 patients that we are aware of, none had any reported blood clots in the legs or in the lungs. So I think what we know so far is that, first of all, the people with HHT don't seem to be more likely to be catching COVID-19 than other patients. Secondly, most of the people with HHT who have developed COVID that we're aware of have had similar outcomes to the general population, in that most patients had mild disease, though a small percentage of patients had severe disease, similar to the general population. So what do we do? How do we apply this to the advice that we give our patients? I can tell you, what I say to my patients, and what we recommended in the webinar. And as I mentioned, I've talked about this little survey that we did of HHT centers. There's a little bit in the medical literature too, some cases reported, but very little information for us to go on, published information for us to go on about HHT and COVID. But what we do understand in general is that HHT patients seem to be affected similarly to the general population. Though we don't have data on it, we certainly logically imagine that there are some patients with HHT who would be at higher risk of getting really sick with COVID. And because some patients with HHT have problems like heart failure because of their HHT. And those heart failure patients are probably very similar to heart failure patients who don't have HHT. So we think that someone with HHT who has a heart condition secondary to their HHT, in other words, and that's usually connected to liver vascular malformations. If someone has that and they're being, typically it's someone who's being treated for a heart condition, or on medications for heart failure, they're seeing a cardiologist, that person, for example, may be at higher risk of getting more severe COVID or getting more sick with it. Similarly, people with symptomatic or severe liver dysfunction, or people with low oxygen levels from severe lung AVMs, or people, and this is a little more controversial, but people who have severe bleeding and uncontrolled anemia. So I don't know if you've noticed, but every line it's either written there or I've said it, I've used the word severe. So this is not to say that people who have HHT of the liver, or who have lung AVMs, or who have chronic bleeding in HHT, most of those people would not be considered higher risk of getting really sick with COVID. It's the people that have the very severe end of the disease, where they're very symptomatic, on lots of medications, frequently visiting the hospital, et cetera. So I just want to be really clear about that, because I think it's been pretty scary for a lot of people with HHT, thinking that just having HHT might put them at higher risk of getting really sick with COVID. So what do we recommend for prevention in our patients with HHT? The routine measures, of course, those that we know are effective, such as social distancing and wearing a mask. Also, we've been recommending and trying to remind people to be as cautious as they can be about disinfecting the hands before handling the nose. Obviously, patients with HHT have to handle their nose more than other people do, because they're managing nosebleeds or using treatments in their nose. So being really careful about disinfecting the hands as much as possible before doing so, to avoid hopefully contracting COVID by bringing it from your hands to your nose. The next one is, as soon as you possibly can, get vaccinated. The HHT community has no HHT related concerns or reasons to tell you to avoid getting vaccination. Not so at all. I think the community is really, very much in agreement that it's something to be recommended to our HHT patients. And then I just want to clarify, because sometimes people are unsure about what they should do about their HHT care. And Dr. Ratchin just answered some of this really, really nicely, I think. We're trying to recommend to people that they don't routinely delay their recommended procedures or appointments for their HHT care. I'm not saying, and just as Dr. Ratchin said, it doesn't mean that everybody has to proceed right now with their care, but I think people should think carefully about weighing the risks and benefits, and talk to their HHT center, talk to their doctor about what those might be, because sometimes it's not very clear. Sometimes people, I often have the experience that people think when they come to see us at St. Mike's that they're coming to like the hotbed of COVID, because we're the HHT center in Toronto, and Toronto's had pretty high numbers of COVID at times. But in fact, if you call and you ask us what's it like today at St. Mike's, and what was it like last week, and what's it been like over the last few months, we've had very few COVID patients, and we've not been overwhelmed, and we've been able to take appropriate precautions to make it low risk for patients. So these are things that can change with time. So you want to always be checking in with the place that you're going to your appointment, or with the doctor who's recommending a procedure or appointments to you. But I would just strongly suggest not to just categorically stop going for appointments or procedures because of COVID concerns, but check in with your doctor. And same, this applies to your medications and infusions, et cetera, as well. Because what we don't want to see happen is people's HHT care neglected and people end up in the hospital because of a complication for their HHT, when we could have helped maintain their care and keep them well and at home. So stay in touch with your HHT center, whether it's through virtual care or in-person care, and balance those risks and benefits with the team that's looking after you. One last slide is about vaccines. So I just thought I would put up a bunch of common myths about COVID vaccines and try to provide what I think is the best answer to them. Just because there's a lot of myths flying around, a lot of concerns flying around about COVID vaccines. So some people think that it's a useless idea to vaccinate because the effect will wear off quickly and we don't have a lot of data about the long-term effectiveness. And that is kind of true, that we don't have a lot of data about the long-term effectiveness. But on the other hand, we know that we've seen very high effectiveness rates in short term, and that if we need to, then eventually we may need to just have a revaccination interval or process. I think everyone's expecting that. So to me, that's not a reason to avoid vaccination. Second big myth that gets a lot of attention is that the COVID vaccine, especially the novel ones, will alter my DNA or alter my genes. Absolutely not. It cannot do that. So that is a very clear-cut, easy one to answer. Number three, the vaccine will cause COVID infection. No, not so. It may cause you some symptoms that feel like an infection, and that's because your immune system is reacting and creating sort of an inflammatory reaction, but it's not infection. There is no live virus in any of the vaccines that are approved. Virus mutants, number four, virus mutants will make the vaccine useless. Well, it may reduce the effectiveness of the vaccine. There's evolving data about this, but some of the interesting newer vaccines will be fairly easy to re-engineer if needed for variants. So I think there's optimism. We can be optimistic in that regard. Number five, if I've reacted to the flu vaccine, then I will react to the COVID vaccine. Not likely, pretty different ingredients. Number six, there's no point in getting the COVID vaccine if I've had COVID. That's not true either. Even if you've had COVID, the current recommendation is that you would still go ahead with vaccination, and that the vaccine would still, the goal of the vaccine would still be then to extend or to boost your immunity against COVID. And then finally, people with a bleeding disorder like HHT, for example, can't get the COVID vaccine. That's not the case at all. Unfortunately, it's been a bit unclear in a lot of the vaccine directives. There's this, one of the points that says, don't get it or be cautious if you have a bleeding disorder. And that has nothing to do with the kind of bleeding disorder that HHT is. It's for people that have a clotting disorder and who might be at risk of getting a big bruise at the injection site. But there's nothing about COVID vaccination that would be expected in any way to cause HHT related complications. So this concern does not apply to HHT. So sorry, I said that was the last slide. This is the last one. What to do if you get COVID? I just wanted to make sure to have a quick run through about this. So first of all, if you think you have COVID and you think you need a test, when you go to a testing center, ask for the swab to be done. If you have nosebleeds, ask for the swab to be done through the mouth rather than through the nose. When they do the nose swab, it's actually the kits work. The swab is basically inserted through the nose to the back of the throat to the pharynx. So it's actually a throat swab, a nasal pharyngeal swab that is typically used for COVID testing. And that swab can go through the mouth and is approved for use through the mouth to the back of the throat as well. So there should be no problem in obtaining a swab through the mouth instead of through the nose, so that you don't have to worry that they're going to trigger a nosebleed. Second thing is, if you get COVID, call your HHT center or your physicians to let them know and get their advice about any of your ongoing therapies. I wouldn't suggest that you routinely or categorically stop any medications that you're on or treatments that you're on for your HHT, But if you're on some medications, actually ones that we're going to talk about more tomorrow, but things like tranexamic acid or hormonal therapy for bleeding in HHT, or intravenous bevacizumab for severe bleeding in HHT or for liver in HHT, then those things need to be discussed, because it may be that while you're sick, just during the period that you're sick with COVID, that you might, we might consider stopping those. But all of these things need to be discussed and individualized patient by patient, based on the risks and benefits. All right, so we are ready for questions now, and happy for Raj and I will share the questions, and happy to discuss any that you have.
Thank you so much for such an informative discussion. Honestly, it's been a topic on everyone's mind, I'm sure, especially the rebuttal of the common myths that have been spreading around about the COVID vaccine. So I really appreciate that. So one of the common questions that I received is actually, when it comes to vaccine availability, are HHT patients deemed to be in the higher risk group? I know you mentioned in regards to COVID, not so much, but should they be considered in regards to vaccine availability, and should it be available to them earlier than the general population?
So that's a really good question, and I can take this first one, Raj, but please jump in if you want to add to it. I'm going to go back, sorry, to this page here. These patients, the patients who have these severe problems at the bottom of the slide, these are the patients where I think we clearly need to say, these people may be at higher risk of severe COVID, and so these people should be prioritized with people with chronic, as are other people with chronic disease, for earlier vaccination. But if somebody who has HHT and nosebleeds and treated lung AVMs, and who's, and the rest, and otherwise has no other symptoms of their HHT, and they're not severely anemic, like they're not needing intravenous iron or blood transfusions, that sort of person probably has a risk similar to the general population.
Wonderful. Another question is actually in regards to COVID. Some people have been hearing that it can cause blood clots. And could this be problematic for patients with pulmonary AVMs?
So, Raj, do you want to answer this one?
Yeah, I can take that one.
Okay, great.
The fear over COVID and blood clots was primarily from the early reports we had of a lot of people either having strokes or blood clots in their lungs. And the more we've learned about it with time, it's now becoming clearer that the risk for blood clots is the greatest in people who are critically ill in the ICU with a COVID infection, and not so much in people who are at home quarantining because they have the COVID, or people who are managed as outpatients or after discharge from the hospital after a brief hospitalization. So I want to reassure people that yes, there is a subset of people who get COVID that may be at a higher risk for developing blood clots, but this is the patients who are sick in the hospital. And in that subset of people, we are already giving them or taking measures to prevent blood clots from developing anyway, because we're all very aware of it. So that's that's what we know about blood clots and COVID.
Wonderful. Another question in regards to hygienic purposes. So what would you recommend if someone is in a public place and is experiencing a nosebleed and they were unable to disinfect their hands at the time, especially with how things are right now?
That's a great question. So I'm happy to try and answer that, and Raj, you can add on after if you like too, because these are obviously things that, solutions we're trying to find for our patients and trying to be creative about sometimes. So, first of all, I tell my patients if they're somewhere and they have a nosebleed and they're wearing a mask, that they need to obviously find a private place before they're going to remove their mask and manage their nosebleed. They can, however, if they can't do that right away, they can apply pressure over the mask. So, one of the ways that we suggest people apply pressure is putting take my glasses off, it'd be easier, is putting the fingers over the nose like this and applying pressure just below the bone. And you can do that with a mask on. It's obviously not very comfortable and not ideal. But if you are in a situation where you can't remove your mask and your nose starts to bleed, that's an option. If you can get to a private place and remove your mask and manage your nosebleed as you usually do, then that's the best thing. I've been trying in general to recommend to my patients that they keep a little container of hand sanitizer and like that they make themselves even a little nosebleed kit in let's say a small Ziploc bag with a small container of hand sanitizer, a couple of instead of tissue, maybe a couple of the little gauze squares that are pre-wrapped, because those are sterile until you pull them out too. And so if you're somebody who has to put something in your nose when it's bleeding to help it stop, because some people tell me that that's definitely what they need to do, then I say, open your kit, tear out one of those gauzes, just stick it in, then wash your hands, because you have a minute now because you've got the gauze in. Wash your hands, take another gauze out, and switch. So that the thing that you've put in your nose that you've contaminated, you've taken it out very quickly again with clean hands. So those are the kinds of things that I'm advising my patients to try and help them reduce the risk of contaminating their nose. Raj, do you have anything you want to add to that?
It's the exact same thing. We are just, most of our patients that deal with recurrent nosebleeds have a kit that they have. They have a nosebleed kit in the car, in their handbag, what have you. And we're just reminding everybody to have either sanitary wipes or hand sanitizer in there, and then just as you said, take the other precautions. But yeah.
Great suggestions, honestly. Another question would be, is it possible that COVID infection could potentially worsen AVMs or potentially even lead to more AVMs?
I guess it's possible. We've never seen any other infection do that. So, not suspecting that, but of course, is it theoretically possible? Yes. The patients that I've seen so far who've had COVID and that we've heard about so far from other center directors about their patients that have had COVID, there has not been even the slightest suggestion of that though so far. So I think it's unlikely.
Yeah, the one thing I'll add there, which may be a question that you're lining up to ask, is, does getting the COVID vaccine make my nosebleeds worse? And I've encountered that in a couple of my patients who have told me that for a day or two after they got their vaccine, their nosebleeds were a little worse. And that is okay. I mean, I can see why that would happen if you're mounting an immune response after you get the vaccine and feel all achy and a little worn out for a day or two. Maybe as part of that immune response, the nosebleeds may get a little worse, but fear of that most certainly should not keep you from getting the vaccine. Just want to put that out there too.
Great point, Raj. Yeah, I totally agree.
Awesome. So a viewer is actually curious in regards to your thoughts on what they've heard in regards to vitamin D and potential protection against COVID. Any thoughts on that?
I'm not aware of any convincing evidence that vitamin D protects against COVID infection. I am aware that 2/3 of Canadians are vitamin D deficient, so I don't see a big downside in routine vitamin D supplementation, and especially during the winter. I mean, we've got some sun here today in Toronto, but we don't get a lot of it in the winter. So I think that there isn't much of a downside to considering routine, regular dose vitamin D supplementation, particularly during the winter. Raj, do you have anything additional to add to that? You have better weather than us anyway, but.
Yeah, that's right. No, I haven't come across any convincing data one way or the other. And there is really no downside to vitamin D supplementation, particularly in a vulnerable population.
So a common symptom for COVID is an increase in fever. would we expect at all for fever to play a chance in increasing nosebleeds or the reoccurrence of nosebleeds?
Sort of as Dr. Kasthuri said, when people with HHT are having an inflammatory reaction to whether it's a vaccine or an infection or another illness, sometimes, and with or without fever, sometimes that will exacerbate their nosebleeds, though I haven't often found that to be a big clinical problem. Like when my patients, get influenza or when they get other viral infections, I haven't honestly routinely heard from them that exacerbates their nosebleeds. And if it does, as Dr. Kasthuri said, it would be, perhaps for a few days, but not that it would cause a long-term worsening of their nosebleeds.
Perfect. And for the last question, now, although COVID hasn't been that long, it's only been roughly around a year now, but has there been
long.
any, absolutely, feels like forever.
Sorry, did I say that out
loud? In regards to potentially long-term effects, has there anything been recorded in the literature in regards to HHT patients and COVID infection throughout the span of the year?
No, not specific to HHT that I'm aware of. As I said, most of there's small numbers of HHT patients that we're aware of that have had COVID infection. I mean, maybe HHT patients have been more careful to self-isolate and taking precautions, being good about taking precautions, because we really haven't seen very many cases. And in those cases, they were largely mild disease, but patients who did not require admission to hospital and did not have long-term effects. Will we see some patients with HHT with long-term effects from COVID? Maybe, I would expect so, since there are others and there are such in the general population, but I don't have anything additional or any additional information on that. One thing I can tell you is we are trying to gather information about COVID outcomes in HHT patients. So, though we're saying we don't have a lot of information yet, which is sort of good because there haven't been a lot of infections, we are trying to systematically gather information, and there are multiple different groups doing this, but we're doing this in part of the our HHT registry, which is a registry that we recruit HHT patients to at several sites in North America, and that is funded by the Cure HHT. The registry was created by and funded by Cure HHT, and we have a specific set of data that we collect from people about COVID. Have you had it? No. Were you tested? Yes. No. What kind of complications did you have? And we'll follow those people up long term. So one of the reasons, when I said to you earlier in my slides, like if you get sick, let your HHT center know. The first reason to do that is to get their advice, but the second reason is so that your HHT center learns about what happens with their HHT patients when they have COVID infection. So please do call us, join studies that are available, and tell us about your experience so that we can learn and give better advice to our patients.
Yeah, the one thing I'll add to that is, again, this is not specific to people with HHT, but in general, there is this syndrome they're calling post-COVID syndrome. There's been some talk about it. I think there's still uncertainty as to how best to define this post-COVID syndrome, but at least they are recognizing that, and this is among people who were sick enough from COVID to be hospitalized, either for some period of time, that a subset of them are continuing to have more protracted recovery at home, a slower return to baseline function, and things like that. So they're lumping all of that into this concept of post-COVID syndrome. If you want more information about that, and you're going to go look on the internet anyway, I would point you towards there's something called the IDSA, Infectious Diseases Society of America. They have some information on it. At least it's vetted by a group of people who put thought into this, and not just stuff out there on the internet. So there's something there that would be a good resource for you. So, but it's still early days. I think we'll learn more in the coming months about, does this really exist, and what do we do about it?